I would probably be a lot heavier and a lot more tired than I am now. I am able to do a lot more and have a lot more energy, and I feel that I probably would have gotten sicker if I hadn't done the surgery. I had several knee surgeries to the point where my weight was just affecting not being able to recover well. It was hard to stand, it was hard to walk, it was hard to go upstairs. I was very inactive for a long time, and the longer I was inactive, the more weight I got, to the point where it was very hard for me to move and just do everyday things. So it was one of the main motivators for me to do the surgery.
Nancy and I go way back, and she's known me since I was a fellow in training. She's the practice manager of the clinic. We together designed and put forward our vision for what a bariatric surgeon's process and office should look like, how it should run, and we're both quite proud of the work that we've done together. Nancy had the Roux-en-Y gastric bypass. In short, that is kind of two steps in one during the operation. First, we create a small stomach pouch, and then we divide the small intestine and plug that into the newly created stomach pouch. The goal is to have the majority of the stomach and the majority of the first part of the small intestine bypassed, hence the name. This leads to the wonderful hormonal and metabolic changes that we want to see in our patients afterwards.
With a minimally invasive surgery, or a surgery that doesn't cause a lot of damage to your insides, you recover a lot easier from that. So it's something that at home, 2-3 days of just walking around the house, taking it easy, and then I want to say about the 4th, 5th day I was ready to go to the grocery store and do things outside of the home. The nutrition classes were very educating. I have a background in bariatrics already, so being on the patient side was a little bit different than being on the clinical side. It opened up my eyes to the process, the mentality of wanting and needing to make that change. So the nutrition, I had 12 nutrition classes that I needed to take with my particular insurance. So going through that process and knowing that there was a goal at the end of it just kept me going.
When you choose our team here at St. Luke's Sugar Land with Baylor College of Medicine and Baylor St. Luke's Medical Group, you can know that your team is going to treat every single patient with the respect and the time that they are due as a human. You're going to not only be educated about what the surgeries look like, but about what is going on with your body. Because there's a problem with messaging in morbid obesity. We work to correct that here. We work to get people correct information so that they can be informed and make their best choices for themselves.
Today I can now go upstairs. I take the stairs every morning and every afternoon to get in and out of the office. I'm working on starting to jog and run. That stuff I couldn't do before. I couldn't keep up with my kids. Both of my kids are athletes. My son plays baseball, my daughter is a soccer player, and going out and seeing their games, going to their games, and just having the energy to keep up with them during practices and being able to participate, took a lot out of me in my heavier weight. And now we can do and enjoy things together instead of me just being on the sidelines. With the surgery, I don't have issues with blood pressure. It's actually very even and steady now. My blood sugars, we do blood work several times throughout the process, and every time that I've done the blood work, my blood sugar and my cholesterol is normal.